You've probably heard me say on more than one occasion that as an intervertebral disc degenerates, segmental motion increases. Most segmental motion in the human neck occurs at the C5 and the C6 motion segments to begin with. And when the discs, the C5 and C6 discs, degenerate, even more segmental motion occurs. And the research has shown that when our patients move their neck, if they have a degenerated disc at C5, C6, or C4 even, motion is going to occur at those segments first, before the other segments. So the neck loses its normal cranial to caudal motion sequencing. That's one thought process. And it relates to the prescription of generalized range of motion exercises. And in this video clip, we're going to emphasize side bending and rotation. So let's look at side bending a bit more. If we have a patient side bend their head to the right and then pull, what we've successfully done is placed a great deal of tension on the brachial plexus on the opposite side and closed the intervertebral foramen on the same side as the side bending. Now, the intervertebral foramen are only 10 millimeters high to begin with. And with every millimeter of loss of disc height, there's about a 20% reduction in the size of that foramen. So most of our patients, particularly patients who are getting posterior neck pain and referral into the C4, C5, or perhaps C6 distribution, they don't need their intervertebral foramen closed. Many of them with tension-sensitive radiculitis don't need to have their brachial plexus pulled upon. Similarly with rotation, if we prescribe a generalized range of motion exercise that looks like this, or perhaps with some assistance, or something that maybe looks like this, a combination of rotation and side bending, each time we have the patient rotate their head, okay, they're closing intervertebral foramen on the same side toward which they're rotating, and again, they're stretching the brachial plexus on the opposite side. Keep in mind my initial comments on this video clip that if there's a degenerated disc at C4, and in particular at C5 and C6, we're going to get more rotation and side bending at those segments to begin with. And here's two other thoughts to keep in mind. The joints of von Luschka are not well developed at the C5 and C6 level. And given that, more rotation naturally occurs at those levels to begin with. In addition, the transverse foramen, which houses the vertebral artery as it makes its way up the neck and into the hindbrain. The transverse foramen is only 5 millimeters lateral to the von Luschka process. In our patients with degenerated necks, these von Luschka processes typically grow. And when they grow laterally, and they grow right toward the vertebral artery. If we have our patients rotate their neck, there's an increased chance of causing further compression and closing of the lumen diameter of the vertebral artery by a facet joint on the same side that we're rotating toward, and by the von Luschka process on the opposite side toward which we're rotating. The long and short of all of this discussion is the more you know about pathoanatomy, the more you know about pathomechanics, the less inclined you are to prescribe generalized range of motion for your patient's neck. How do we keep the C4, C5, and C6 segments safe? Well, we demonstrated that in a different video clip. And it's no more difficult than using a standard leather belt, which most patients have in their home, or using one of these physical therapists developed stretch-out straps. And we place that stretch-out strap right around the bilateral lamina of either C3 or C4. And when we prescribe rotational self-mobilization, we make sure that the C4, the C5, and the C6 segments don't move, that they stay in mid-position. And same if you do some type of coupled or non-coupled motion where you're combining a side bending and rotation. Don't let C4, C5, C6 move. Don't let them move because they're already moving enough. Early grade disc degeneration causes those segments, which already move the most to begin with, causes them to move more. And you're not doing your patient a favor by having them repetitively side bend and rotate through those segments.